Hey everybody, it's Dr. Levi with your show, The Dr. Levi Show. Today is our Q&A. Lots to discuss today. Today is April 19th, 2017. Spectacular day here in Los Angeles. So I hope wherever you are today, you're making it a great day. I feel amazing. I feel rested. I feel just happy to be with you today. So much to discuss. I want to go over your questions from Facebook, from Twitter, from YouTube. We got a lot to talk about today, so hold on and get ready. As per usual, our show on Wednesdays, the third Wednesday of every month, is devoted to gamers and the gaming community, which I love so much, which I'm a part of. And speaking about gaming, guess what? I'll be at E3, so I got two words for you, of course. Game on. So get ready for that. Really looking forward to being there. I was there last year. It was really just a blast. Seeing everyone present, gaming, active, available, seeing the cosplay, just a great environment for us in the gaming community. So as the eSports doctor, as a gaming doctor, I'm looking forward to interacting with you there and just know that this show is really about the gaming community. It's about getting you healthy and fit and giving you a platform whereby you have sustained fitness, because so often in my private practice here in Los Angeles, I see gamers from all over the world who come in with severe injuries, often due to things that can be prevented. Well, how do you prevent that? We prevent injuries, of course, with rest. You prevent them, of course, with stretching properly and with also knowing your body. You have to be in tune with your body. When something is painful, when something doesn't feel good, well, guess what? You have to do something about it. So either, go to the videos that I have on YouTube, look at some of those, try those, talk to your doctor, see what he or she tells you about what you can do to prevent injury. But I want to say we have a library right now, a real extensive catalog of videos to really, really help you to stay focused, target about your goals in fitness as well as in gaming, but more importantly, to keep you healthy. All right, so as per usual, I want to thank you again for joining us on Facebook, on Instagram, on Snapchat, on Twitter, on Twitch TV, YouTube. We're on all those platforms right now. And speaking of Twitch, don't forget, Twitch TV is the first Saturday of every month at 7 p.m. Pacific Standard Time, where I really will take all of your questions live, interact with you, talk with you, see how I can help you. And then also, the great thing about Twitch, it gives me a chance to know what you want to talk about. So our next video that will be coming out in a few weeks will be for the OSU players. So I think that will really be what I call a pivotal transitional video, because it will really give insights to not only OSU and the OSU community, but really the more common injuries that are in that community and what I can do as an orthopedic surgeon, as a fitness guy, to help you. So lots to discuss coming up, a lot of great things coming up. So I'm really happy that you joined us today. So let's get started. Let's go over your questions. The questions today that I'll be going over and reviewing, they're very extensive. There's a lot of narrative, but I want to go through everything with you so you can really have an idea of what they're asking, and then I'll tell you the answers and things that I think can help the person who submitted the question. Okay, now this is from Facebook, and it's pretty extensive. It says, I'm a fan of yours from the Netherlands, loving what you've been doing for gamers all of this time. Now, I wasn't sure if this would be the correct way, but I still wanted to try. I'm 21 years old, living in the Netherlands, and I'm a soft, handicapped gamer. I'm saying soft here because there's people out there that have it more terrible out there. I've been born with an Erb's palsy in my right arm. Luckily, the doctors did their best. I'm able to use my right arm. I can use my right arm to wave, to shake hands, or even pick up something such as a drink. But if it's something heavier, it will hurt a lot, even after I've stopped. Luckily, gaming works out for me. I had to switch the mouse to the left hand and use my right arm for the keyboard. And I'm nowhere near a pro, but I'm not too bad, I must say. Now I've been searching everywhere to see if I could do anything about exercises, ones I can do without the full need of my right arm. I understand I will still have to try and train my right arm, but it's been a really hard thing to do, and I must say I've been slacking to do so since my birth. I am 81 kilograms, which is 180 pounds, and my height is 5'11", which, if I'm not mistaken, is 180 centimeters. Again, terribly sorry if I'm in the wrong place here, and thank you for what you've been doing. Well, you're in the right place. How's that? So happy to get your question from the Netherlands. So let's talk about a few things about Erb's palsy. So Erb's palsy is an injury to the nerve roots, cervical nerve roots, C5 and C6. And it's about 20 to 25% of all brachial plexus type injuries. Now, let's talk a little bit about what happens with that. Often with the Erb's palsy, someone's arm is actually internally rotated, and it's actually called the waiter's tip hand. Their arm is internally rotated, and their hand is sort of open behind them. Now, let's talk about exercise for that. The great thing is to hear that your doctors, that they did what they could to help you to have better function of your upper extremity. Now, these are the things that I recommend if you have an Erb's palsy. Number one, be sure that you've already had and spoken to a physical therapist and that you've had extensive physical therapy. Second, I recommend that you do exercises for internal and external rotation of the shoulder. You can go to the website. There are a lot of exercises there about that. I recommend that you try doing an exercise like this, whereby your hands against the wall and try to walk your fingers up the wall, walk your fingers down the wall. All right? Then I also recommend that you just try this, is opening and closing your hand. Opening and closing. Now, for that, you can use a stress ball. A stress ball is like a putty ball, basically. Or you can simply use putty. So you put the putty in your hand and just simply squeeze the putty through your fingers. Then you regroup the putty together. Then do that again. Now, all exercises, again, should be done at least for repetitions of 10 and maybe 2 or 3 sets of 10 once or twice a day. Now, the issue with Erb's palsy is that it's one of the brachial plexus injuries that really you can do fairly well if you really have extensive physical therapy. Now, from you said that you're 21. Now, even at 21, I always tell my patients that even as you get older, this game is not over. You can still do physical therapy. Now, other things about Erb's palsy that I recommend, of course, with respect to gaming, is that you don't stop gaming because you have Erb's palsy. Of course not. So do what you can to make sure that your mouse sensitivity is maybe very high so that you don't have to use a lot of force when you use the mouse, if you can. Secondly, but you said that you use the keyboard for your right hand, but I would still say try to use the keyboard, try to use the mouse, I should say, for the right hand also. Now, and then to make sure, of course, that your keyboard is an ambidextrous or ergonomic keyboard, I should say, and that your mouse is ergonomically balanced also. So I hope those exercises help you. I want to hear from you to know how you're progressing. The key with exercise is like it's a lifestyle. You have to do those exercises every day. It's like eating properly. You want to eat properly every day. You don't want to have the what many people call the day off when they can eat and do anything. It's the same with exercise, and if you have an Erb's palsy, do something every day to strengthen your upper extremity. All right? And gaming, of course, is a great way to do that. So I hope that helps you, and I look forward to hearing back from you. Next question is, I saw your video on trigger finger, and I just developed this 2 weeks ago. Not sure about surgery, but my thumb is straight, and sometimes it bends. I have to snap it back. I'm taking an anti-inflammatory and wearing a thumb stabilizer. What exercise is good for when it's locked straight? Okay, so let's talk about trigger thumb again. So trigger thumb, this is also called stenosing tenosynovitis of the thumb. Now what happens is, this is your thumb here, and right here there's a pulley. This pulley is called the A1 pulley. Often it can become pathologic, meaning it can be very thickened, it can be fibrotic, it can be enlarged, it can cause stenosis of your flexor tendons of the thumb, meaning that it will become so thickened and tight that your thumb will lock down, and when you want to move the thumb, you literally have to pop the thumb up like this. Well, we see this more commonly in diabetics, and in my practice, I see it more in diabetics and actually people who smoke and have kidney disease. Now, why people get it, No one clearly knows. The research about that, why people develop locking fingers, we just don't know. Now, I will say this, I've definitely found a correlation in my practice with gamers as well as with people who have diabetes and who smoke and have renal failure or renal disease. So with that said, let's talk about some exercises for that. Number one, I recommend massaging your thumb in this area, circular motions, and reverse the circles 5 times in each direction for sets of 3 to 4. I also recommend that you just move your thumb up and down like this. Now, when you do that, of course, there are going to be times when that thumb stays down and locks or clicks. Now, if this clicking and locking persists, well, in medicine, there are 4 different things that we do for this. So let's talk about that. The first, of course, is therapy. We try physical therapy and or occupational therapy for it. If that's not efficacious, if not efficient, it doesn't help, then the next thing that we do is an injection. Now I'll say this, in my practice, even before the injection, I'll often recommend, after physical therapy, acupuncture. I really love acupuncture. I've said this, I'm a big pusher about acupuncture. I think it's very effective, underutilized, and really underappreciated overall in the medical community. So I use acupuncture in my practice also for that. And then if that doesn't work, then the next thing that is almost by necessity would be an injection of a steroid. In my practice, I use Kenalog. Some people use Depomedrol and they use other things, but I use Kenalog. And I found it to be one of the best medications for someone who has trigger thumb or trigger finger. And I'll inject about 0.5 to maybe 1 cc max of the steroid along with a little bit of Marcaine. And usually what I found in my practice, it will go away. Now, when it doesn't go away, if it does come back, then the next thing we talk about is maybe 1 more injection. I never give more than 2. And then if that doesn't work, then the next thing would be surgery, which is the surgery is called an A1 pulley release. The surgery takes about 3.5 to 5 minutes. It's like really quick. However, as I've said before, even though I'm a surgeon, the goal with surgery is really to not do it. You know, because surgery does one of 3 things: makes you better, makes you worse, or no change. It's always one of those 3. So if anyone tells you, well, you can do surgery, you'll be 100%, you'll be fantastic, don't believe the hype. It doesn't work that way. There can always be complications with surgery. There can be complications such as infection, bleeding, pain, scarring, reflex sympathetic dystrophy, chronic regional pain syndrome. A lot of horrific things. Cannot wake up, can have a stroke during surgery, have a reaction to anesthesia. A lot of major issues can occur with any type of surgical procedure, even if it's just taking off a toenail or taking off a fingernail. Things can happen. So even as a surgeon, and I think by the grace of God, someone who really loves surgery, and I love operating a lot, only when everything conservative has failed. So if you're having trigger thumb, I recommend doing the massage therapy. Consider taking an anti-inflammatory medication after you talk to your physician to see if he or she thinks that you could do that, or if they think that the injection is necessary, or physical therapy, occupational therapy. And then, as I said earlier, if all of those things fail, guess what? You're pushed in a corner. The last thing would be surgical procedures. And like I said, it's really quick, it's really easy, and people usually do extraordinarily well. The thing I hear more often than any other surgery, I say second to carpal tunnel, is this statement: if I had known it was going to be this easy, Dr. Levi, I would have done it a long time ago. So I don't want you to be in that segment of the population. I want you to be pain-free, no locking of your thumb. So I hope that helps, and let me know how you're progressing and how you're gaming with the thumb also. All right? Now, next question. Again, this is from Facebook, and it's a long narrative, so I apologize for this, but it's long, but we have to be specific because I really want to make sure that we honor the people that send questions, and that when I repeat the question, I repeat everything the way they've asked. All right? So let's begin. This is, again, from Facebook. I've been attracted to you by your YouTube videos and find it great what you can do for the gamers. I have already been operated on for carpal tunnel, and I have fewer complaints, but the complaints are not quite gone. In addition to this indication, I have tennis arm. Now I'm doing your exercises, which I find great, by the way. I work a lot as a graphic artist on the PC, and beyond that, I play a lot of video games. In addition to the carpal tunnel syndrome, I recently received the diagnosis of impingement syndrome. And here comes my question. Can the impingement syndrome have a negative effect on the tendons that lead to the carpal tunnel? Or can the impingement syndrome have caused the carpal tunnel syndrome and the tennis arm? Thank you and many greetings from Germany. Okay. Well, before I answer your question, let's say I really love Germany. I had great food there, met a lot of really wonderful people there. So let's talk about your question now. So now, two things. When you said impingement syndrome, you didn't say where the impingement is, because you can have impingement syndrome at your elbow. You know, for the cubital tunnel, the ulnar nerve can be impinged upon there. You can have impingement syndrome at your shoulder. So it's not clear where. I'm going to assume here that your impingement syndrome is your shoulder. You also said you had tennis arm, and tennis arm, I'm sure you're referencing lateral epicondylitis, also called tennis elbow, as well as carpal tunnel. So I want to break down everything very stylistically. I shouldn't say stylistically, but very pragmatically about each of those. So let's go from the carpal tunnel to the impingement at the shoulder. So again, carpal tunnel is caused by impingement of the median nerve in the carpal canal by the TCL, the transverse carpal ligament. So for the surgery, what we do is we make a very small incision, about 1.5 centimeters, really tiny, and we release that. Or it can be done arthroscopically. I'm not a big fan of arthroscopic carpal tunnel release. Now, when that's released, there's no further impingement or stenosis of the transverse carpal ligament on the median nerve. Now, when someone presents with carpal tunnel syndrome, they're going to have numbness and tingling and often pain in the thumb, index finger, middle finger, and half the radial aspect or radial half of the ring finger. So again, thumb, index finger, middle finger, half of the ring finger. Now, they may also have pain at night that awakens them. They have to shake their hands out or massage their hands or put their hands in warm water. They may also have a loss of dexterity of their fingers and decreased grip strength. So, as well as night pain, as I said, that may awaken them. So, if your complaints are not completely gone after you've had a carpal tunnel release, it may be because there's still substantial swelling around the nerve. That may take time to go away. Sometimes it can take 6 to 12, even 18 months to go away. However, if it persists after that, then it's prudent that you and your doctor discuss getting another EMG, NCV. These are electromyographic type studies to check your nerve conduction velocity test. Now, if they come back and say, okay, you still have impingement, then possibly the transverse carpal ligament was not completely released and you may need to have the surgery done again. So again, if you're still having the problem with carpal tunnel, you may need to have surgery redone. Now, let's talk about lateral epicondylitis, or tennis arm as you called it, but it's actually called tennis elbow. So this is a problem at the insertion of the extensor carpi radialis brevis, the ECRB muscular attachment, a tendinous attachment, I should say, at the lateral aspect of the elbow, right next to the extensor carpi radialis longus. Now, if you have inflammation there, or pain or swelling on the lateral aspect of your elbow, if you have pain when you extend your wrist, if you have difficulty when you're gaming because of elbow pain on the lateral aspect of your elbow, then this is often consistent with lateral epicondylitis or tennis elbow. Now, how do we treat that? Let's talk about it. Well, first we try bracing it using a compression brace, elbow brace on the elbow. Secondly, if that doesn't work, if it's not effective, then physical therapy. If physical therapy doesn't work, then acupuncture. If acupuncture doesn't work, then we also have to make sure that where you're working, that your desk space, the arena that you work in, where you play, that this is ergonomically balanced. meaning that the keyboard, the mouse, your backrest for your chair, everything is ergonomically balanced. That's very, very important. All right. Now, if none of those things work for lateral epicondylitis or tennis elbow, then the next thing we talk about would be an injection. So again, like the trigger thumb or even carpal tunnel, we give an injection to the lateral aspect of the elbow. And again, I use Kenalog as well as a little bit of Marcaine or 1 or 2% lidocaine. Now, usually after the injections, most people have a great overall relief of their symptomatology of the pain that they're having. Now, if that doesn't help, then later on we do another injection. And if that doesn't help, then you talk about surgery. But again, surgery is the last thing for that. And as a gamer, again, with all the gamers I take care of, I've operated on many, but I try not to because we really don't want to do that. All right? Now, the question that you asked is about impingement. So impingement in the shoulder can be from the acromion. It can be from a tendon issue, from a muscular issue. It can be from weakness of the shoulder, musculature of the rotator cuff or rotator cuff tear. There's so many things that can cause impingement at the shoulder. Now, if you have impingement, again, the first thing I recommend, of course, is that you have an MRI. You have an MRI of the shoulder to look at the musculature around the shoulder as well as to see what is actually impinging. Is it a bony problem? Is it a muscular problem? Is it a tendinous problem? Is it an instability problem? Is it a labral problem? There are so many things that can be involved with respect to impingement. So with that said, no, I do not believe the impingement caused the carpal tunnel or the carpal tunnel caused the impingement. So there we have it. Now, but I will say this, you have a lot going on with your upper extremity. A shoulder issue, an elbow issue, as well as a wrist and hand issue. If you're gaming that much and you have all three areas of the upper extremity in that state of, I want to say, stress and trauma, you really have to think about the following. Number one, doing physical therapy for the entire upper extremity, including the ultrasound, iontophoresis, strengthening, stretching, massage therapy, moist heat. All of these things, I believe, will give you some relief. The second is to make sure that you're exercising every day. The third is to really manage your diet. And diet is not one of my favorite words. I really, really think about it as eating lifestyle and eating modifications, meaning that often you can develop issues like this if you're not eating properly, but if you eat a lot of things that the body doesn't really need, like a lot of sugar, a lot of salt. You know, salt, of course, can cause more swelling in your body, can cause more overall global edema. So things like that can actually cause an impingement syndrome, even if it's transient, because of the increased salt in your body. Now, if you're exercising every day, I also understand as fit as you can, that will also help your mind, because exercise, of course, will help to just minimize and decrease the amount of stress that you have overall. So bottom line is, no, I don't believe the impingement caused a carpal tunnel or vice versa. Secondly, I do think you should really consider resting off the game that you're playing and maybe playing something different for a while or playing slightly less. I'm not saying give up gaming. No, we don't do that. We're gamers. This is part of our life. It's part of our community. We game. We kick butt. However, you do have to look at the long-term issues here of that. What do you do later on in life? Whereby you still need to use your hands. You need your hands. You need your elbows, your wrists, your shoulders. You need to use these areas of your body. So if you're having pain there, then my job is to let you know what can I share with you to minimize that and also to get you feeling healthy and gaming forever. All right? So I hope that helps. All right, next question. I think that was a really long answer, but I hope it was effective for you. All right? Next one, again, a fairly long narrative, but I want to go through the question the way it was presented, out of respect. Okay, so this is Dr. Levi. I've been playing OSU, that's OSU, for 2 years. At the moment, I have gotten problems with my index finger, or my tendons in general, but it's mostly affecting my index finger. It has been feeling really weak and uncomfortable. About my tendons in general, I even have a hard time holding a glass without shaking a little bit. But I'm mostly concerned about my index finger. It feels weird, just bending it sometimes more in an uncomfortable way. So I was wondering on what I should do. Do I have to take a break from OSU or any exercise that'll help my actual index finger? I'm aware of reasons why it is like this. A while back, I spent way too much time and built stress in my whole wrist and ended up with a long-term pain. I suppose it was RSI. And RSI, of course, is repetitive stress injury. But I don't have that pain anymore. But since that happened, my lower left arm has been super weak, and I'm doing what you recommended in your videos. But I don't know what to do about my index finger. If you have any tips, I'd appreciate it if you could let me know. Well, I have a lot of tips. So I want to show you several exercises. Of course, these will be included in some of the videos that we'll be producing for OSU. So now you may be having pain in your finger either from use of the stylus on the stylus on the board, or I don't know if you're having pain in the index finger that's using the keyboard. So you weren't explicit about that. I'm going to make an assumption that you're having pain in the index finger that holds the stylus. You know, 'cause you're holding the stylus really like a pencil. So I want to show you 2 exercises for that. So imagine this is your hand flat on the table. I want you to try this. So spread your fingers wide on the table, or flat on the table, spread your fingers wide. Now just lift your index finger up like this, straight up. Bring it to the side, out. All right. Bring your index finger around in circles, like that. Back around in circles, like this. And then full fist, in and out. So let's go one more time. So your hand is flat on the table, like this. I'm going to do it from this perspective. But again, imagine your hand flat on the table. I just want you to see this. So first, bring your index finger in and out like that. Okay. Now, again, your hand is flat on the table, so in and out. Then bring your fingers together and just lift your index finger off the table, up and down, like that. All right. Now, circles with your index finger around. This will be pretty tough, but I want you to do it. 10 around that way, and back 10 around this way. Okay? And then a full fist. In and out, for a set of 10. So I would say use those 4 exercises to really help overall strengthen your hand and to give greater flexibility and durability, I want to say, to your index finger. Now, what's so important to me is that you reach back to me and reach out to me and let me know how you're progressing, because it's so important that I get feedback to give you guys more than what I'm giving if I know it's effective, and to change things if you tell me, hey, that helped a lot, but is there anything more that you can give me? Or if something wasn't as effective as someone else told me, I want to be able to add to the catalog of exercises that we're giving. So with that said, OSU is a great game. I like it a lot. I've played it a few times now. Very intense, very, very tough. A great game. And speaking of that, I want to reiterate, within the next several weeks, no more than 4 at the most, we'll definitely upload our first dedicated OSU video about the problems that are often seen in the OSU community, as well as exercises to help them, as well as, and more importantly, as well as things to help prevent any type of injuries that do occur. All right? So I hope this helps you with your index finger. The other thing about the index finger, too, that's important is this exercise. So take a look. So again, we talked about up and down here and side to side. We talked about circles. I also want you to try this. Cross the index finger over like this. Cross the index finger over your middle finger. Just cross it over. 1 over. This may be a little difficult, but I want you to try this. So a set of 10, 2 to 3 sets, once or twice a day. All right. So those are some index finger exercises. I hope they are helpful for you. And then let me know. If they're great, fantastic. If they help a little bit, still let me know. I want to be aware of that. All right. Next question. And again, this is also from Facebook. A lot of Facebook questions. Give me 1 second here. Okay. The question is there something you can do to avoid getting tired and losing focus? Therefore, playing worse over the course of a gaming session. Well, one thing about gaming, it is fatiguing. And I would say the best thing to not lose focus and to not be tired is, number one, make sure that you're exercising properly every day, eating properly. And while you're gaming, to avoid any type of energy drinks, avoid caffeine, coffee. I would not do that while gaming. I would avoid any types of teas, anything that has a lot of sugar in it. You know, those things, as I've said before, they give you this great pickup, but guess what? It may lift you up a little while, but then when it drops you, it's down, down, and down. So I don't want you to go into that abyss. So I think it's so important that, number one, when you're gaming, you stay well hydrated. You know, I'm going to talk about this on another video about things that I think every gamer should have on his or her desk or table. I think it's so important that there's certain things, certain types of foods that I think should be on the desk of every gamer while they're gaming, even while they're taking a quick break every 5 minutes. I should say every hour to take a 5-minute break. There are certain things that I believe, if you have them on your desk, will help you to push through successfully during any type of gaming arena. Any type of game that you're playing, I should say. All right. The other thing I was going to say about this is, you know, if you don't have a lot of energy and feeling focused, to make sure that every day that you're taking time to meditate, to simply sit still, be quiet for about 15 minutes. Just sit still to let your mind really calm down. And while you're sitting there, just think about as little as you can. Or you might want to concentrate on a word like gratitude, or maybe peace, or harmony, or rest, or success, or prosperity, whatever you want to do that really just allows your mind to come down to a peaceful place. I think that's so important, because with great thing about meditation, it gives you a chance to really focus on what are your career goals, what do you want to achieve today, short term as well as long term. It's like exercise. When you're exercising, you're making short term and pushes to be fit and healthy to reach your long term goals. It's not like, you know, going out trying to do everything in one day. Just do a little bit every day, and you'll see that your body changes. You get more and more fit. The six-pack that you want, it's already there. You just have to exercise enough so that it shows to give you what you want. You know, it's like being healthy. It is a lifestyle. So if you're losing focus, don't have a lot of energy while you're gaming, number one, look at what you're eating. Diet is critical. When it comes to fitness, you know, many of us believe that diet is 80 to 85% of the issue and exercise is 15%. So we really have to exercise and really have to focus on being as healthy as we can. So for you, I recommend staying well hydrated. Make sure that you have proper snacks at your desk. I'm going to talk about that on the video soon. And of course, that you're getting proper rest, and that you're meditating, that you have your short-term and long-term goals about what you want to achieve, not only in gaming, that's only part of the deal, but about your life. I want you to think about, what do you want to achieve in life? How do you want to be of service to humanity? That's part of our issue here too. All right? So I hope that helps you. But again, hydrate, eat properly, exercise daily. Take your 5-minute break every hour of gaming to stand up, shake out your hands, to walk around, to make sure that you're pumping your calves, you know, things like this. These are things that will really help your body overall to feel better. All right, next question. Okay, this is a question about rage. Dr. Levi, can you talk about gaming rage? So, Let's talk about that. We had a little discussion about that on Twitch TV. So I'm going to talk about it here just briefly because that's such a very long subject. So it's a very interesting subject, but it's very intense. So when it comes to rage, I want to remind you, before you do anything, before you throw your keyboard, before you break your mouse, before you throw your chair through the window, before you throw your chair toward the monitor and the TV screen, it's important again that you stop, take a break, walk away from your desk 5 or 10 minutes and come back. Just get up and walk away. Don't touch anything. Right when you think you want to just pick something up and break it up, stop, breathe, count to 5 or count to 10, but walk away and then come back. Because you come back, whatever you break up, you have to pay for it again. You have to get it again. It can be very expensive. Another keyboard, another mouse, another monitor. So that's what I recommend. All right. So next question. Dr. Levi, is scoliosis hereditary? That's a great question. Well, I don't know of any gene that will definitely predestine someone for scoliosis. However, there are a lot of genetic problems that people may have that will also have scoliosis. Let's talk just briefly about scoliosis. Scoliosis, there are really like 3 different issues with scoliosis. It's failure of formation, failure of segmentation, then there's a mixed form. And this is failure, formation, segmentation of different parts of the vertebrae of the spine that can cause scoliotic deformity. Now, there are different types of diseases, for example, that can have scoliosis. For example, like Marfan's or neurofibromatosis. There are a lot of genetic diseases that have a scoliosis component. Now, I will say this: if you have scoliosis, it's really, really important that you go to your doctor to see if she or he can do something preventative for you. For example, they may give you stretching exercise. They may talk about therapy that you can do. They may want to take x-rays every 6 to 9 months to see how your spine is looking. Are things changing? Is it becoming worse? Is it progressing? Are you developing a kyphosis, which is a humpback type deformity? Are you developing things like that? So it's really important that if you have scoliosis, be it thoracic, lumbar, wherever it is, that you get seen by a doctor. Now, often, I know here in the U.S., often they have scoliosis screening at a lot of schools, especially during the physical exam for some children. They do that here in the U.S. I don't know about that globally, if that's done. I think it's a very good way to screen and to hopefully prevent the further progression of things like that. But it's important that if you have it, if your mom or dad or your caretaker or whomever, or even a roommate says, hey, your spine looks funny, or hey, your spine looks odd, or hey, do you notice that you're leaning more, or that you're not walking properly, or that your head is turning a certain way, or that you seem like you're not your gait, is slightly off. All of these things, you have to definitely go and be seen by a doctor. Don't try to treat yourself. Don't just go and be seen by a doctor. Scoliosis can be very serious. And then there's some times when, we can just treat you with therapy and you're fine. Other times when we actually give someone a brace that they'll have to wear for a certain amount of time and a certain number of hours per day to hopefully get some correction of the scoliotic deformity. With that said, again, I want to reiterate this over and over. As a physician here on YouTube and virtually like this, I don't have the privilege and honor of actually examining you. So it's important that you go to the healthcare provider in your community to be seen and evaluated. I'm your virtual doctor, which is great. I'm grateful for that opportunity to be of service. But I want to say, I want to again reiterate with this disclaimer: you have to go and be seen by your family practitioner or healthcare provider in your community if you have any issue. Because again, I don't have the pleasure of actually getting your complete history, of examining you fully and getting the proper tests like x-rays or MRIs, all these things, and blood tests as needed. So make sure with all the answers that I give today, everything that we talk about, still is important to be seen by your doctors. All right? Now, next question. Hey, Dr. Levi, I've been diagnosed with cubital tunnel syndrome. I was wondering if you have any tips for me to fix naturally so I don't need surgery. It's so painful. Well, yeah, cubital tunnel can be very painful. Let's talk about cubital tunnel. So cubital tunnel is impingement of the ulnar nerve at the elbow, the medial aspect of the elbow. And cubital tunnel is spelled Cubital, cubital tunnel syndrome. Now, with cubital tunnel syndrome, so let's talk about one other thing we talked about briefly, and that is carpal tunnel syndrome. This is this area of the wrist. Cubital tunnel syndrome is this area now of the elbow. Now that nerve, the ulnar nerve, comes down this way and provides nerve sensation to your small finger and to the ulnar aspect of your ring finger. Now, if someone has cubital tunnel syndrome, guess what happens? They have pain, they have numbness, they have tingling in the small finger and part of the ring finger. They also have sometimes decrease in dexterity of those two fingers. Now, why people develop that, we don't know. I see it often again in diabetics, and I see it in smokers. I see it in people who have had trauma to their elbow. So, why people get it, we don't have any specific credible research papers of why. But we do have ways of how to treat it. So the first thing with cubital tunnel is the following. Number one, bracing. You can wear an elbow brace at night that will block you from bending your elbow when you sleep at night. It will keep your arm fairly straight. All right? Now, if the elbow bracing is not effective, then of course, therapy. Physical therapy is a great way of treating this for a while to see if there's a decrease in your symptomatology, if there's a decrease in the amount of pain that you have, or swelling that you have. So, now guess what? If that doesn't work, once again, you've heard it here earlier, I always love invoking the power of acupuncture. And then if acupuncture doesn't work, then we can sometimes give a real tiny bit of steroid injection there to see if that will decrease the inflammation around the ulnar nerve. However, the issue with cubital tunnel syndrome, unlike carpal tunnel, is the following. For carpal tunnel syndrome, the impingement is at one area in general, and that's at the transverse carpal ligament. For cubital tunnel syndrome, guess what? You may have an issue with the two hairs of the flexor carpi ulnaris muscle, where that area is impinging on the ulnar nerve. There are different types of tissue. I was going to start naming those, but that'll be confusing, I think, for our audience, and it's not that important. Then there are other areas where you can have impingement of the ulnar nerve, as well as at the intermuscular septum, which is pretty high in the arm, which can also cause impingement. So there's really a lot that can cause this issue, but for surgery, the surgery for that usually takes about 20 to 40 minutes max, and we release the areas of impingement over the ulnar nerve. Now, with that said, if you have to have surgery to do this, the surgery is really, in general, it goes really, really well. It's for us as hand surgeons, for example, is what we call easy surgery, because we do so many and we do it so often. It's really it's not that difficult to do. Now, with that said, if you have to have the surgery, in general, people do really, really well. But make sure that you talk to your doctor about that. Make sure that you talk to him or her about a second opinion. Always get a second opinion before you have any surgery. When I say critical, it is critical. Even my own patients, before surgery, I'll tell them, I'll say, why don't you get a second opinion to see if someone else wants to do something differently. Or maybe they'll say you don't need surgery. And I'd say about 99% of them still come back and say, yep, that person agreed that I want to have surgery and that I need surgery. So that's important. That you get a second opinion from someone that you believe and trust. And also, don't let your doctor give you the referral. Don't let that happen. You want to go outside that box and find someone else. So do your research. The great thing about the internet, what I love about the internet, it gives us what I call international connectivity. Everybody's connected now via the internet, via Facebook. You can just put out a message that, hey, does anyone know a good orthopedic upper extremity surgeon in my area? Does anyone know a good neurologist? There's so many ways now to connect with people. Now, the other thing about Q-tip tunnel I want to reiterate is that you want to make sure that you get an EMG nerve conduction study also to make sure that it is only the ulnar nerve that is the issue, and that it's not an issue with the ulnar nerve only at the elbow. It could be the ulnar nerve also at the wrist, because there you can have impingement of the ulnar nerve at an area called Guyon's, G-U-Y-O-N''S, Guyon's canal at the wrist, which is this area where the ulnar nerve may also be impacted. So bottom line is this: if you have Q-tip tunnel syndrome, I recommend the night splints first, taking your breaks while you're gaming, and as well as make sure that you go to be seen by your local doctor so that he or she can do the EMG nerve conduction study. All right? So I hope that helps you. Next question is, this is from Twitter: what do you think of using sports gels for wrist relief during excessive gaming? I'm not a big fan of those. I've not found any of those to be effective overall, and there's no great science or great papers I've read that say that it's effective at all. So I'm not a big fan of those. Now, next question, again from Twitter: I have pain in the right index finger due to excessive use of laptop touchpad. Please suggest any remedy. Yeah, well, I gave those exercises earlier for OSU, so you can do the same exercise I talked about. Again, your hand is flat on the table, index finger up and down, cross the index finger over, index finger in and out, up and down, making a full fist like that. Those are some basic exercises that will definitely help you. The next one is, I had wrist and elbow pain, this is again from Twitter, and elbow pain for a few months. Lately, a couple of my fingers have gone numb. My desk is too high, I think. What do you recommend? So, yes, if your fingers are going numb, I recommend the following. One, that you consider doing the gliding exercises. Again, the elbow is straight, and you bring your wrist around in circles for a set of 20 this way, a set of 20 in the opposite way, then a loosely closed fist, 20 that way, 20 the other way. And you can look those up on my YouTube channel. Again, they're called gliding, Gliding exercises. All right, and these are things that we do to help prevent carpal tunnel syndrome. Or actually, not necessarily prevent, but minimize the symptoms of it. All right? So, yeah, you should look at your desk height also. Make sure that everything is fairly ergonomically balanced. Again, on YouTube, I have a video there about making sure that your desk is properly balanced with respect to how far your monitor is, your chair height, your elbows. Everything is listed in that. Excuse me, guys. I have two more questions. Does hard workouts and excessive routine influences much players' wrist in good or bad ways? Well, the key with working out is, yes, you have to work out. Make sure you protect your wrist when you're working out or lifting weights to keep your wrist in a neutral position. Even if you're doing a bicep curl, when you're doing a bicep curl, don't flex your wrist up when you're bringing the weight up. Make sure that the wrist stays in neutral position. The other thing is, after working out, one critical issue that I talk to, I have this question with all my athletes is, make sure you stretch after exercising. So often people work out. After they finish working out, they just walk out the gym. That's not the deal. You want to make sure that you're stretching after you work out, all right? Our last question here. I have a question. I hope it's not a bother. I've got some kind of tickling under my nails. Okay, well, if you have a tickling sensation under your nail, it can be a lot of different things. It may just be a tickle under your nail. However, also under the nail sometime, if you have cold sensitivity, specifically, you can have something called a glomus, Glomus. I'll spell it again, glomus, Glomus, a glomus tumor. I see this maybe once or twice a year in my practice. Someone who has pain in a finger, they will say they have a feeling of a tickling sensation under the fingernail, or they'll say they have a lot of cold sensitivity, that if anything cold touches the area of the nail, that they just can't take it. It's very painful. So that's the issue there. So I got through all our questions today. I want to thank everyone. I really appreciate you. Again, thanks for joining us on Twitter, Facebook, Instagram, YouTube, Snapchat, Twitch TV. So many markets. We're here to be of service to you. So I want to thank you again for the questions. Join us again for another Q&A at the third week of every month. And this is Dr. Levi. 2 words for you. You're ready? Game on. Take care. Bye, everyone.